myself Dr Monika, faculty of physiotherapy department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please like, share and subscribe the channel.
The axial skeleton. The axial skeleton consists of skull, vertebral column, thoracic case, and sternum. The axial skeleton, skull. The skull is situated on the upper end of vertebral column, and its bony structure is divided into two parts, the cranium and the face. The axial skeleton include cranium. Cranium, it is formed by flat and irregular bones that provide a bony protection to the brain. First one is frontal bone. It forms the forehead. It forms parts of eye socket. The coronal structure sutures joins the frontal and parietal bones. Two parietal bones. It forms the side and roof of the cranial cavity. It articulates with each other at the sagittal suture. It joins the frontal bone and coronal sutures, and occipital bones with lambdoidal sutures, and the temporal bones at the squamous sutures. Now, two temporal bones. These bones lie one on each side of the head and form immovable joints with the parietal, occipital, sphenoid, and zygomatic bones. The temporal bones articulate with the mandible at the temporomandibular joint. One occipital bone. It forms back of head and most of base of the skull. It has immovable joints with the parietal, temporal and sphenoid bone. One sphenoid bone. It occupies the middle portion of base of the skull, and it articulates with the occipital, temporal, parietal and frontal bones. One ethmoid bone. It occupies the anterior part of base of the skull and helps to form the orbital cavity, the nasal septum and the lateral wall of the nasal cavity. It is very delicate bone containing many ear sinuses that opens into the nasal cavity. Now the face, facial bones, nasal bones form the bridge of the nose, maxilla form the upper jawbone, form most of the hard plates, separate the nasal cavity from the oral cavity. Zygomatic bones, commonly called cheek bones, and form the prominence of the cheeks. Lacrimal bones form the part of medial wall of the each orbit. Platinae bones form the posterior portion of the hard palate. Inferior nasal conchae form a part of inferior lateral wall of the nasal cavity. Now the vomer forms the inferior portion of the nasal septum. Mandible, lower jawbone, the largest, strongest facial bone, the only movable skull bone. Nasal septum divides the inferior of the nasal cavity into right and left sides. Broken nose in most cases refers to septal damage rather than the nasal bones themselves. Orbits, eye socket, foraminas, opening for blood vessels, nerves or ligament of the skull.